Hi there, everyone, and welcome to another Facebook Live event. My name is Amanda Bassos, and I am the Regional Clinical Outreach Director with Lifeskills South Florida. And if you're joining us for the first time today and not too familiar with Lifeskills, I'd like to take a moment just to give you a little information on our programming. Now, Lifeskills South Florida is a dually licensed treatment facility located here in South Florida, where we offer a full continuum of care for adults who present both with complex psychiatric disorders and substance use disorders. And we offer a residential level of care and outpatient, including PHP, IOP, and transitional living as an option. Now, we've been around for 30 years here in South Florida, offering the clinical care that we provide, which again is for both complex psychiatric disorders and substance use disorders. And we're able to provide the clinical care that we do given our 6 evidence-based clinical pathways. And those include DBT, CBT, cognitive remediation, trauma, metabolic fitness, and our substance use clinical pathway. Now, I'm excited today to introduce one of our primary therapists at Lifeskills South Florida, who comes to us with over 15 years of experience in the mental health and addiction field, Sandy Bernstein. And Sandy's, of course, our primary therapist. She provides individual and group therapy at Lifeskills, really focusing on support within cognitive behavioral therapy, motivational interviewing, DBT, and of course, solution-focused techniques. But what's also really special, Sandy is an expert within cognitive behavioral therapy and has been trained through the Albert Ellis Institute in REBT, Rational Emotive Behavioral Therapy. So thank you so much for joining us, Sandy, and welcome to our Facebook Live event.
Well, thank you. Happy to be here.
Thanks. Yeah, we're glad to have you. So, gosh, with all of the experience that you have, Sandy, years of experience and expertise in the work that you do, I'm just shocked and glad to hear about the additional training that you have in REBT. I think that's such an additional and very special modality to incorporate in the clinical work that you provide and that we provide at Lifeskills. So one of our pathways, as I just discussed, is our substance use pathway, specific for individuals who have histories of substance use or active addiction for that matter. Can you tell us a little bit about what that pathway looks like at Lifeskills South Florida?
Yes, we offer a variety of groups. One of the main groups, it's called Chemical Dependency DBT, and what that is all about, it integrates DBT principles with 12-step principles. In addition to that, we offer other groups, principles of recovery, relapse prevention, coping with triggers and barriers, and a spirituality group. We also encourage participation in community support meetings. For those clients who aren't connected or they don't support 12-step recovery programs, we also encourage SMART recovery and or refuge recovery. Very important, connected in the community.
Yeah, no, that's absolutely true, especially with this season that we're in. Isolation is such a big part of, potential relapse and concern for people in general with mental health or with addiction histories. So establishment in a community is so essential right now. And I love what you mentioned about Lifeskills, where we're not the traditional 12-step model program, but we encourage the 12-step philosophy and we encourage our clients to connect in whatever group they feel the most connected with. Absolutely. Now, can you talk to us a little bit about cognitive behavioral therapy and or REBT and how that might be helpful in supporting an individual with substance use disorder?
Absolutely. So REBT is essentially under the umbrella of CBT, and it focuses on the thought-emotion connection. And so what it teaches is that our emotions are associated with the evaluation of an event, not the event itself. And so to speak in layman terms, the beauty of that is that we can't change what is, but we can learn to modify or replace a belief that we have about what is to which would be associated with how we feel. So that would then translate into a different decision, making different decisions because we would feel better inside. So when using REBT techniques, it first starts with working with a client to identify some issue, some challenge they're having at the present time that's causing them some distress or emotional discomfort or pain.
Right.
And so we help them gain insight that they're experiencing the emotion based on their belief about what's happening, what they're struggling with, the event. So we teach them how to identify that belief, learn to challenge, either replace or modify that belief to a healthier, rational belief where the associated feelings or emotions would be healthier, and that would translate into making better decisions. With a clearer mind, we can think more rationally, and that would prevent relapse and increase success of maintaining a sober lifestyle long term.
I love that. That is wonderful. What a helpful modality that really incorporates a trauma-focused mentality as well, that honoring an individual's perception, which is what their reality is, and recognizing where they're at and meeting them where they're at, which is what we also do at Lifeskills. And I appreciate that incorporation into the clinical care that's given. I also love that it's based in so much hope, that we can correct those irrational thoughts and have more adaptive experiences, right? Both in thoughts and actions. So that's wonderful, Sandy. Thank you for sharing that. Now, I know we spoke just a moment ago about just how prevalent isolation is during this time. If there is an individual, watching this right now who is wondering, what the next step could look like, or really what to do next, and, not really feeling connected, and, the potential is there for any type of relapse, what recommendation do you have for professionals supporting other individuals or individuals themselves in terms of what to do?
I think it's very, very important to develop a daily sober schedule and adhere to it, to include exercise, self-care, good sleep hygiene, good nutrition. And in addition to that, very, very important to stay connected in community. And in times today, there's all the support meetings are being offered online via Zoom meetings. And I can't encourage strongly enough that people should attend a minimum of one meeting a day. If for those that are home a lot and they have a more free time on their hands, more meetings. I mean, the more the better, because it's a way of really staying connected. It's very important to reach out to sober support, very important to maintain frequent contact, if not daily contact, with your family and friends. We don't want to stay isolated and get stuck in our own head.
Yeah.
That's never a good thing. So the more we talk to people, the more interactions we have, the more activities that we engage in that bring us pleasure and make us feel productive, the better we're going to feel, therefore make better decisions. So, and then when we do leave our home, please to remember to wear a mask and practice social distancing.
Absolutely. Well said on two fronts. The community piece, so integral to continued care. Absolutely. Couldn't have said that better. And I love that, we promote the continued community care, both within Lifeskills and also within any respective community group that our clients are a part of, and how that translates into caring for oneself and caring for others, especially during this time, practicing best recommended practices to mask up and socially distance when appropriate. So thank you, Sandy, so much for your time and your willingness to join us on this Facebook Live. We're grateful for your expertise and your ability to share all of that information with us today. If anyone is watching, yes, thank you.
Thank you.
For all watching, if you have any additional questions about Lifeskills South Florida, about our substance use pathway, about cognitive behavioral therapy or rational motive behavioral therapy, please feel free to reach out to myself or to Sandy. We are more than happy to answer any and all questions. And we hope that you'll join us next time on our next Facebook Live. We'll see you soon. Thanks for joining, Sandy.
Thank you. Stay safe.
Thanks.